One of the things that we recommended for this, also was in our paper, is that, of course, the initiation of multi-kinase inhibitor shouldn't be stopped in any patient with advanced thyroid cancer. We should be based on the performance status, the tumoral burden, the disease progression, if the patient had a disease potentially symptomatic or symptomatic. And so we tried to recommend to avoid any delay in obtaining images. For those patients who were under multi-kinase inhibitors, we said that these patients should keep the social distance and lockdown, to respect them, to register all the adverse events and communicate the adverse events to the medical team through telemedicine, and do not postpone images and control. And the special situation, what happened with this patient under the dabrafenib and trametinib, we faced some troubles because this patient presented with fever. Fever is one of the most frequent adverse event with the combination of the dabrafenib and trametinib. It may happen in around 30 to 40% of cases. And this was the case with our patient. So this patient had like 4 or 5 swaps while he was treated with the dabrafenib and trametinib. We needed to discard that this patient was not infected, had not COVID infection. So finally, we assumed this was a situation mainly because this patient was going to many centers at that time. And we didn't know much about the infection, about the way of transmitting infection. And so we did these swaps several times for confirming that this patient did not have a COVID infection.